So, Dr. Savleen, welcome to our success story. And first of all, congratulations for your very nice result. And here you are for sharing your own journey for this MRCS. So you can start with from like the part A, when you have passed that, and when you have started the preparation for part B, when you have given your exam, how did you have prepared? Did you have practiced with any partners? And what were the strategies you followed? What are the study materials you followed? Is there anything else that you have gone for these preparations? What was the exam situation? How you have handled your stress during the exam? Any specific um, funny things or like frightening things that happened during the exam as well? And how you're feeling right now, just after the result, like you can share everything with us.
Okay. Hello, everyone. I'm Dr. Savleen. I'm from India. I'm a general surgeon, and I have joined IMG in August 2023. I gave my part A in May 2023, and then after the results, I didn't know that I'll be appearing for the part B in the same year or not. But through friends and through internet, I got to know that his course is the best, and so I contacted him personally, and I would like to say thanks by saying that when I contacted him, he said that if you want to have, I requested for the hard copies, but I said, sir, I don't have the money right now, so I'll join after 1 month. He said, it's okay, you send me the money later on, I'll dispatch the hard copies because it will obviously take one month to reach to you. So that moment, I was very sure that yes, he's the mentor. When he's putting that much of efforts, even without taking money from me, you already dispatched my notes. I'm really, really thankful to you, sir, for this nice gesture. And he called
See,
me to.
the thing is, Dr. Savlin, the problem, I don't know why is this. We're the neighboring country of India, but it takes the longest time to reach in India, about my books, right? It takes 1 month
I
or more than 1 month to reach. I don't know why. What's the problem? But if you're thinking for Pakistan or Nepal or Sri Lanka or any other, like maybe in Dubai as well, it takes only
yes, sir.
10 to 12 working days,
Yes, sir.
right?
It took me 40
Like,
to
I
get the
don't
notes.
know. Right.
So
Okay.
I was very impressed, and thank you, sir. Thank you for that
No, no,
gesture.
thank you for all of your kind words right now, Dr. Samplin.
And he called me to clarify, and he literally said that you are joining in August, but our course will be starting in September, October. So don't worry, you will be in the older group, and don't feel like that, oh my God, I have just joined in between, what is this guy doing and all that. So he reassured me that you'll have a separate course. So it's like, okay, a good way to start. So I booked my January Hyderabad 2024 exam for part B. But unfortunately, the results I got were of a candidate who appeared in Kuala Lumpur 2023 September session. So when I got my result, it was written, you appeared in Kuala Lumpur September 2023 session and you have failed the exam. And it was at that time I was attending a CRISP course with Echra and Dr. Tanveer. I showed them my PDF, so this that happened. So they counseled me to just reply them back and contact them. But this is England. England guys are very lazy in this. I have heard that had it been Edinburgh, they would have responded it quite well. So I had no choice. I don't know whether I actually flunked the exam or whether it was a computer glitch. But ultimately, I failed. So I was not feared of the failure. I was eager to pass the exam. So that day I got my result at around 5 p.m. Indian time. At 9 p.m. After like 2 hours of crying and whining, at 9 p.m. I booked because my parents told that you used to tell us the seats book fast. So I'm thankful to my parents for telling me that I immediately after 4 hours, I just booked the exam. So this is one thing I want to tell the people who are failed, who got, I would say not failed, who could not make it. I would want to tell you that attempt doesn't matter. Your effort matters. Your results are delayed. Your fate is delayed, but this is just temporary. And
Just to add a simple thing, with your words to all the candidates who have given their exam, but they're a little bit short, maybe for 2 marks, 3 marks, 5 marks, 7 marks. I want to say all of them that it doesn't mean like you are not like, well enough to be like an MRCS as well. Is it so
Yes.
like the 2 marks or 3 marks? Does it make any difference? No, right? You and me is the same. Just this is not your perfect time of having this, and you need to go for a second attempt, and inshallah you will be passing it smoothly, right? So it's just a system that is making us pass or fail, but the ideas, the knowledge, the skills are almost the same.
Yes. And
Okay.
so I had like 2 months, April and May. So I didn't want to forget what I have already learned for the January exam. So in that quick rush, in just April and May, I brushed up and then appeared for the June exam. So I know people ask that how much time does it take? It's a very common question. How much time does it take to prepare? So I would like to tell them it's not about how much time, it is how many times have you done. How many times have you read? Kindly rephrase your question and ask yourself. It is not about the time. Many people are quick readers. They just read once and they are perfect. People like me, I honestly need a reading of around 6 to 7 times to be very honest. Until I have read the knowledge section, I would say. Until I have gone through the text 6 or 7 times, I can't confidently say that I know this subject. So if you ask me how much time, I would say this is a wrong question. I would say six, seven
Right.
times for
Just
I
see, like Dr. Rajiv said, like he have gone through maybe twice or thrice, right? He say just said that, and you're saying like you have gone through at least six. It depends upon the candidates, right?
yes,
Like after how many times you feel comfortable to go for this exam, it entirely depends upon you. Yeah, good.
yes, and I know that the thing is that whenever you are reading knowledge, you read it like once and you say, "Oh, this is very long. This is very I am forgetting it." No, every person knows that how many readings you. This everyone knows how many readings you take to grab that. I know I take 5, 6 readings, 7 readings maybe to master that. Everyone knows I am a slow reader. I take 5 times to know the subject, 6 times to remember, and 7 times to master it. So in for the January exam, I did the same. For the June exam, I did the same. One thing I want to tell you that even after I flunked the exam of January, I did not equate it to any other course. I just stick to my notes. I reopened my notes, which I really didn't want to again. And I reopened knowledge notes. I reopened my skills notes, went again through them. And this time I had one obviously self-doubt that maybe I have not done enough of images, because I remember people doing MacMins, people doing knitters, and for the January exam, I didn't do. But to be very honest, this time also I didn't do, because there are too many images. There are images in the mock, there are images in the class sessions, there are images in the QRC sessions. How much you can do? And for a person like me who needs a reading of 5 to 6 times, how can I do? This is impossible. I would suggest. So, and before I thought that I've not read that, if you go through the drive of Sir, you will find extra written. One folder is there, XTRA. And when you open it, you feel very motivated. Oh my God, this is the stuff I want to read. But you cannot make it. I'm telling you, you cannot do it. You can go through it, but you cannot revise it. So I thought maybe I have not read past the MRCS doctor exam books. So this time I'll do these books. So I started doing those books, but ultimately I found out that Dr. Atik has already combined those questions and images in his notes. But because I have read that notes and went to the books and then came back to the notes only. So I would suggest don't go here and there ever in the notes. Yes, in QRCs and in mocks, you will find new images. Just add those images or add those questions in your basic note only. So whenever you are going for a final exam, you know that, yes, this was the image asked in the mock. This was the image asked in the class. So just stick to that only. Make some sticky notes, do some whatever you feel like. You are a software person, you're a hardware person, whatever you feel like. And I have written many questions because when I was listening to success stories, when I was a candidate, I knew what I wanted to listen from them. So I have jotted some points for you all people. So first, so thank you so much to the team, Dr. Tanveer and Dr. Ashra again. And the next is, what will you do before the exam? Before the exam is during the preparation course. So you have your knowledge, you have your skill. So if your exam is in 5 to 6 months and you have booked it, I would suggest you to start the class recordings. Don't wait for the schedule to come. Start class recordings. Suppose you have joined for the October session and you have joined in the August. So you already have 2 months. So just open the drive, start listening. When your October session will come, you will have the idea, okay, I have listened to this. So in the initial time when you are listening to class recordings, you will obviously get a lot of effort. You will sometimes, even if the video is 2 hours, you'll keep on pausing, listening again. It will take you 3 hours. So I would suggest you be very patient in your first reading. That is very important, to be very patient. As you told us in history and communication and everything, you write down
Just
the point.
just one thing, Dr. Savleen, I want to ask you. Is it like, is it okay to go for the first class and then after that, after watching the class, go for the notes, or is it the opposite? First you read by yourself and then you go for the class recordings. Which one will be much more helpful for the candidates in your views? What do you think?
Uh, So from my view, first go through the class, because then you have an orientation how to look at that image, what will be asked in that question. Because when you're doing passive reading from yourself, suppose you have an extensor compartment, you are reading pronator, teaser, pronator, quadratus. But when you go through the class and then come to the notes, you will always read it like pass, fail, fail. So this is how you will read. So don't waste time going through the notes first. Always attend the class first, have a hang of it, have an idea of it. I remember that me being a general surgeon, I have a problem with that duodenum relations. So I remember when you explained in the class, it was beautiful. Like it was actually beautiful. Till date, I sometimes open it, go back to have the idea of that. Okay, this is coming. This is coming. So that is the I guess way of remembering, because you show us that this is you have to remember. I would suggest the candidates to have faith in this course, because if you don't have faith in this course, you won't make it, because it is a very high tendency to deviate it. And I won't I'm not saying that you don't attend any other XYZ mocks. Always go through them, test yourself. Go, like as an I am from IMG, I want to challenge these people that okay, let's see what they can ask us. So go for that, but don't deviate from your own notes, don't deviate from your own class skills. Don't deviate what he has told you, that in the history taking examination this is the sequence. Some people recommend to go for ice first, but I remember Atik sir told that go to the ice last. So don't get confused, stick to one person, have faith. So this is the process, I would say. And I would suggest that yes, I have written few points for you all guys. One question people were asking, that drug charts. Yes, like sir said, go through online. But I would suggest you that whenever you get a new chart or whenever you get a new image, not the anatomy image, suppose you got a graph or some values written, something in the tabulated form. Always look to the chart as if first look at the x-axis. Okay, this is temperature. Look at the y-axis. Okay, this is the sequence. Then go into the middle part. For example, I got a pain management chart. So I looked at, okay, number of the drugs are given and this is the frequency over the x-axis. So that gave me the orientation how to, crack the chart. And I remember during my exam, there was one column in which it was written BS, BS, BS. So I was very confused. What is this BS? So I asked the examiner, sir, may I know? Like you have to be very formal and you have to be very, down to earth, grounded. May I know what is this PS? Because I'm not able to understand it. You have to be honest. So the answer was, this is the nurse's initials. She has just given the drug. And we both started laughing. So, but I was relaxed that at least I didn't leave anything. Okay, what if the PS had something to do with the questions or with the answer? They are actually looking you as how safe you are as a surgeon or a
Very
doctor,
true.
but
Very true. Very
they
true.
just they are giving you a scenarios that okay, if you give anything blank, do you ask us what is this, or do you just interpret yourself that okay, the PS something something HS like something. So whenever you get a confusion in the exam, always ask. I remember I had one examination station.
So
And
I want to add one thing, Dr. Savleen. I think
yes, sir.
honesty should be showed off there, right?
Yes,
Just be honest. Just be honest there. Like if you don't know, you don't know. If you know, just
yes,
then okay, fine, it's okay. But you have to be honest in this exam. It's not like, if you don't know some things and you are making up some things, this will not work there. And they
yes,
will,
sir.
they will, they will know instantly because they are doing this for years, right? So
Yes,
they
sir.
will like you will get caught about that. Just don't do any like that much of stupid things in this exam. Just be
Yes,
honest.
sir.
Hmm.
And also, we are giving an exam for which we'll be getting a post of SHO or a junior fellow. We are not going for a specialist.
Hmm.
So we are will be being supervised. So that is only they are saying that whether if you are recruiting you for a junior post, are you honest with us? Are you honest with the patient? Are you safe to the patient? They are not testing you. Okay, you got 80%, you got 60%. No, nothing is that. So one more thing I remember, I read the station. It was an examination station. It was a diverticulitis, abdominal examination. When I went into the exam, I forgot it was it a history taking or examination. So because it was abdominal pain, vomiting. So I had the station in my mind, but I could not recall it is a history taking or exam. So the moment I went inside, I told the examiner, may I read the stem again? He gave me the stem. He asked me, do you know which station is this? I said, yes, sir, it is an examination station. I around wasted 1.5 minutes in this, but had I started for a history, I would have flunked it. So it's better to waste 1 minute at least if you are not confident. They appreciate it. They actually appreciate this thing. And also in one station, in pathology station, he was asking me, it was stomach cancer. Yes, that, see, all questions were same, CDH1 mutations, blah, blah, everything was same. And I remember that he was asking me that how liver will be affected in this patient. I said, sir, probably might be because of the metastasis. He said,
What else?
he said, what else? So I said, can I read the stem again?
Right.
So it was written, he was alcoholic.
Alcoholic. Yeah.
So I said he might be having an alcoholic liver disease. He was very impressed with this. He actually smiled. Hardly any examiner will smile at you. So don't worry. So this is the thing. If they're asking what else and you are not able to recall it from the notes, go back to your basics, be honest with them, because obviously you are humans. You have been going through a 3 hours of pressurized test. You tend to forget things, but you have to be calm and composed in this. And one more thing for the candidate, I would like to tell you that yes, sometimes during the examination, when you start the examination, it is always the adrenaline rush, which is not in your control. Your heart is pacing. You don't know. You are
All of
actually,
a sudden everything will be blank.
yes, you will
All of a
be
sudden.
blurting answers without even thinking. I started my station with the pathology station. I did not do well in that. I forgot very basic things. He gave me a joint aspirate report. The answer was amyloid, but I forgot. Like, I don't know how I forgot that. I still repent it. And the very next question he asked me, the answer was disclosed. So I could not go back to that station. Oh, sorry, the question. So I even asked him, can I go back to the question? He said no, because the answer is revealed now. So I came out and it was the first station. It was my second attempt. So obviously that was also a pressure. But I realized that no, this is not the thing. You can't do like this. The very next station, I had a communication with the ITU registrar, and in that station, I got it was all rush. The staff is directing you to sit. Then there is no phone. You get confused. In that station, I messed up a few things. I did not perform very well because communication is one thing we have practiced with you guys a lot. We have heard it a lot. We know the answer. There are exactly same question they are asking. So in that moment, I rushed it, and when I came out, so I just paused for 1 second and drank water and just buckled up myself. You cannot perform like this in the second attempt. Took a deep breath, and then the other stations were on fire. So you will mess up few stations. I messed up 2 stations in the examination. So do not worry. If you are confident enough, you are having a smile, so you will make it. So if I can do it my second attempt, I would say everyone can do it. All IMGs can do it. One thing, yes, one more thing I would like to tell you, that do not rush in stating your candidate ID, because take time, be loud. Even if you want to show your card to them, tell them my candidate ID is 2410. Do not think that, okay, he already 30 seconds are lost in revealing the candidate ID. So don't do that. After all, it's all about the ID number only.
All right. So, Dr. Savleen, one thing I want to ask you is, in those time, like, you maybe you can relate, like, just suppose you have did a blunder in your patho for the first station, right? You are having so much like fear, and also you are so much stressed out, right? That these are some of the simple scenarios of our day-to-day life for all the candidates who are going to go for this exam, right? So in that particular moment, what are the things the candidates can do? Because it can be for all the candidates. Should we keep thinking about the previous stations that we have made a blunder, or should we think like, okay, whatever it happened, I have to go for the next station and I have to give my best? What do you think about that?
Honestly, I don't have a very structured answer to this. I would say, I would tell you what I did. This will be complete honest thing. When I flunked first station and then the second also, I just recalled that this is my second attempt. I can't mess up. And I just told myself that you're an MBBS doctor. Kya hi puch lenge? You have read everything all. So hands in the pockets, move to the next station. So they are the examiners. You are dealing with the patients. So just remember in this, go with this spirit that you have done everything. It's like, come on, ask us. So at the after the second, station, this was my only, motivation thing, that kya hi puch lenge? I'm a doctor. I'm also a doctor. So this was only, to be very honest.
Right. So one thing I want to quote from you is, once you surrender yourself to this particular situation, the things gets better, isn't it?
Yes, sir. Yes,
right?
Sir.
So what we can think about, we can say to our future candidates is, you must surrender yourself. Okay, whatever will happen. Just let me give the 100% for this exam, and let's see what our gods have written for us, isn't it?
Exactly.
Yeah.
Yes, sir. Exactly.
Okay. Brilliant.
One more thing I would tell people, that you have mock sessions. I could not attend the June mock sessions, but I was attending January sessions. So in one of the few mocks, I was listening to myself only. I was listening to the mocks, and I found it, oh, this is me only listening to me. So, and I would suggest you to, whenever you are revising class notes, class recording, you can go twice, the first reading and the second reading, to, just have like, okay, if I have not missed anything. Class recording 2 times is enough. Mock recordings as many times, especially patho, especially critical care. Because when you are asking question to a candidate, you give time for him to answer. In the meanwhile, when you are listening to that, in the revision mode, I'm saying, not live, in the revision mode, when you are listening to your question, so you get, okay, this answer I took too much of time to recall. Okay, I forgot this question. And whenever I remember, whenever you are taking mocks, so it was like CL lung mock, but you asked about blood thinners, like out of a random question, warfarin, heparin. So you are just bombarding questions. And in the when I was revising, I forgot. Oh my God! I forgot this coagulation cycle. So you get a new topic to revise from the mocks. So I would suggest to watch the videos in 2x times. And whenever you're watching mocks or whenever you are listening to the revision mode, always listen to in that area when you are busy. Suppose you are traveling, you are in a hospital on duty, because at that time you cannot go for a new knowledge. Just put your headphones on and start listening to mocks. Sometimes you are driving, just I guess many of the candidates have done this, driving and listening things. Whenever
Right.
you are in,
Or just like going on the roads, right?
yes, going on the roads,
I will not,
I would
I will not, I will not suggest drive and listen to my mocks. Please don't do that.
saying
But
that
if
you
you are
are
traveling, do that. Okay? Be safe on the roads, guys.
so being a passenger, you can. So I
Right.
would suggest that whenever you are grasping a new knowledge, grasp in a calm situation, like at your
Hmm.
home or with your study partner, because that is the time you will remember.
Hmm.
Whenever you are going to a mock session, which is very, very must to recall. Even if you know the mock, even if you know all the answers, recall it, refine it, be a master of that topic. That if any question it comes in the exam, you will answer that. So the mocks you need to revise when you are doing a very relative work. Suppose you are doing nothing and you don't want to study, you are watching TV, but you are even not even listening to the TV. So just revise mocks, because this situation will come. There during your preparation there will be 2 curves of studying coming. You will be on fire. You will be studying like you have planned 2 topics. You did 10 topics a day. But then few days will come when you won't even study for like 2 days continuously. So I would suggest you that this is normal. Everybody goes through that. This is a process. Trust the process and just lage raho, like be into the process. So
Right.
that is all I would suggest to go through it.
Okay. All right. Thank you so much, Dr. Savleen, for sharing such a nice journey
Yes,
with
sir.
me, with all the other mentors, and with your colleagues. Uh, Excellent. So hearing, like, see, this is the time I enjoy, right? Because just before your exam, some of the candidates are going to give their exam in August. I'm so much stressed right now with the result of July. So this is the time when some of the results, comes, and we used to do these success stories. These are the times when I feel really happy that you guys have made through, and this is a lot of hard work, right? Like, it's not that much easy, right? For the last few months you are going to go through this, and the amount of pressure, like, only you guys can feel, right? It's a
Definitely,
tremendous
sir.
pressure after you get, like, you have your result and it is mentioning pass.
Pass, pass.
All the Everest, like, pressure over our shoulder are gone, right? We are like a free bird right now. So this feeling is something special, right? This is something special, right?
Sorry
So,
to
and
interrupt
I,
you. There
sure.
was one. Sorry to interrupt you. That so this was actually very important. So during the examination, you will find that some of the candidates will say the examiners were helpful. Some of the candidates will say they didn't help us. So he was giving us a very weird face. I would suggest you that you have to go like you know the answers. Like you tell in your sessions, now you can't ask me a question. That is a beautiful thing. Like whenever we are answering you a question, you used to say, no, you cannot frame the answer in asking no. You have to be confident. Like even if you're wrong, esophagus is at the 8th level. Be confident in that. Just answer that, because the thing is, when you are confident and willing to answer, at that moment the examiners will help you. They will. I remember there was one question. He asked me that, what is massive blood transfusion? I explained the answer. He said, how many bags are defined in a massive blood transfusion? So I started verbalizing in front of him. Okay, sir. So if massive blood transfusion is more than 50% of the blood volume, that is obviously 5.5 liter is the normal. So around 2.5 to 3 liters. It means that 3000 ml. 3000 ml, and one bag contains 300. So approximately 10 to 12 bags. So he said yes, 12 is the answer. So whenever you are thinking, verbalize to him so that he knows that you want to attempt the answer. Because when you are verbalizing to him, he will help you. But when you have paused, he doesn't know that you are thinking. He will think that you don't know the answer. So at that moment, if you verbalize to him, if you start articulating, he will help you. They want us to pass. They are not bad examiners, I would suggest.
Correct. Very true. And one more thing I want to share with Dr. Savleen is, do you agree with me about that? Is it actually matters about the center's passing rate? You have given twice, right? The exam twice. So my question is, if you are well capable of this exam, is there any chance that you are going to fail just because of that, percentage things? Is it so?
Actually, they usually say that it's not about the center, it's about the college. They usually say that England has a lower pass rate, but Edinburgh has a higher pass rate. I would like to tell you that even I had this doubt that, okay, I flunked in England, I should have gone for Edinburgh, I have again gone for England, I should not be doing this. But at that time, I already filled the exam. The thing is that England takes conducts this exam over 6 days. So 40 students are there in one session. So it means 240 candidates are there. And they have to take only 40%, like 30 to 40%. So 240 may say 40% will be obviously less. But Edinburgh takes over 2 days. So only 80 students. So 80 students ka 40% or 50%, half of the candidates have passed. So this is the only difference, that Edinburgh conducts over less days, less candidates. So you have a more probability of passing rate. England conducts over 6 days, more the candidates, but the pass rate is only same. So obviously the fraction decreases. So obviously if you have 240 students, the more students will fail. But I would suggest you keep your preparation like this, that you have to be in the first 10-20%. No center, no college can fail you. If you are aiming for the top 10%, you are in the top 10%, you just need one seat. It doesn't matter if 240 student, 80 student, you need one seat, and that you will get. I would suggest that.
That's what I wanted to say for our course candidate. Don't you think, Dr. Savleen, after all of these things, after all of these efforts, the IMG candidate should target for the, the highest scores?
They should. I am very eagerly waiting that who has scored much in this. Although the pass rates, the
I think
score
Dr.
rates doesn't.
Navdeep maybe.
Yeah, maybe. So, but I guess if you aim for higher scores, I honestly aimed for 141 or 142 in skills. I got 139. So you aim for higher, you will get that. But if you aim for lower, the God will only give you what you aim for. So even aim for 200. I know that is unrealistic. Let's have a realistic goals. Why not? So
Right. Right, brilliant, Dr. Savleen. Thank you so much for sharing in an honest way, of course, in an honest way. The way you have expressed yourself very nicely. Okay, so at this part, I want to have some questions from all the participants who are present right now, and I think Dr. Savleen will love to give the answers for all of your
Yes,
queries,
sure.
if you have
Sure,
any.
sir.
Please, 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 everyone, ask for any questions if you have. Dr. Kelvin, brilliant. Yes, Dr. Kelvin, go ahead.
All right. Good evening, everyone. I'm Dr. Kelvin. Dr. Savleen, congratulations. What I would like to ask is, if you're done answering the question for a station, probably it's supposed to be 9 minutes, and in like 7 minutes you're done answering. What do you do then?
Actually, you just have to sit quietly in a very formal way. I would suggest you to sit the formal way which they have accepted is to don't cross your legs. The same you follow in the communication center. Just sit there and both your hands on your thighs and don't ask them what to do. If he wants to tell you to wait, he will say. If he wants to, some examiner didn't tell me the station was over. So I know if he wants to ask a question, he will ask because they know how this process is. So just sit there, keep your head down if you want, or do not just keep moving around. Sit in a very professional way. Even if they have marked the answer, but always be professional, because sometimes the examiner changes their mind that okay, I have seen professionalism in this person. I can give him one or two marks or something. So never ever get lax after giving the exams.
All right, thank you for your question, Dr. Kelvin. Very good. Anyone else want to ask any question, please? Any queries? No queries. Okay. All right, Dr. Savleen, just before you go, I want to ask, like, what should be the dress code for the female candidate? If you can give some of the ideas about that.
The dress code which they are specifically wanting is if you are wearing something, it should be above elbows. If you are wearing a formal shirt, the sleeve should be rolled up above elbows. You can wear a long kurta also with the normal trousers also. But I would suggest you, whatever you wear, it should be well creased and you should be well groomed. And because if you are well groomed, you feel confident. The examiner knows that yes, this is the candidate who wants to give the exam. Don't go in. I won't recommend going in slippers and trousers. Always
No.
go in formals.
You cannot wear the slippers. You cannot wear the slippers. Like it has been mentioned in the instructions that you must wear something which can cover your foot.
Yes.
Right.
So
yeah.
I'm saying don't go in slippers. Always go in formals.
Right.
And
yes. All right. Dr. Savleen, I think you are having some network issues. Am I audible to all of you guys? Yes, no?
Yes, sir.
Yes, sir.
Okay, I think Dr. Savleen is having some network issues. All right, so I think that's it. And thank you once again for Dr. Savleen. She have mentioned everything in a very nice and clear way. All right. One thing I want to add as for the dress code for the female, like about the ornaments, okay? About the ornaments, you should have not. Yeah, Dr. Savleen, you are back. Could you mention something about the ornaments that the female mostly wear? You are muted as well. Yeah, okay.
You can only wear a wedding ring, that's it, and nothing else.
Yeah.
You can only wear a wedding ring, that's it, and nothing else. And I already mentioned that I don't know if I was audible at that time or not, that even if you have forgotten your admit card at that day, they are accepting it in the PDF form. You can show it in your phone. They're accepting it. So don't worry that if not printed or anything. The passport should be in original. That's the one thing. And one more thing, I remember one candidate in our exam, by default, he took his headphones in the pockets. So obviously it was not his mistake, but Then he admitted, but they were very strict about it, that we won't give you second warnings. So why to create this environment? It obviously decreases your confidence. So don't do that.
All right. Thank you so much, Dr. Savleen, for your very nice experience that you have shared with us. And just inshallah, you will be doing excellent in your future.
Yes, sir.
And see you guys. Okay. See you.
Sir?
All right.
Hello.
Yes, Dr. Tasin, you want to ask something?
Yes, I
Go
want
ahead.
to ask this to you, or Dr. Savleen can answer this also. And congratulations and thank you for sharing your experience, Dr. Savleen. I just wanted to ask that can we wear analog watch?
No, you cannot wear that.
And
No,
about the we can carry
Dr.
our
Dr. Savleen, we can basically carry, or we can wear a analog watch which is not digital one, like the Apple Watch or something. We can carry, or we can wear a like the analog one, like the Casio, like the old
Yes.
one, right? Or the something like we can have
Actually,
round
sir,
shape something.
yes, sir. Actually, sir, when our candidate instructions were being released, they said that below elbow it should be bare. So I'm not
Yeah.
sure about the digital or analog if they are accepting or not, but they were actually asking us to hand over everything in one envelope, and they wanted
Okay,
specifically.
so I think then it is depends upon the center, because when I have given my own exam in KL,
Yes, sir.
one of the candidates were wearing the analog watch, and they have allowed that
Yes,
during
sir.
their
They
exam
allowed
as
me
well.
in Chennai also. They allowed the
Yeah.
analog watch.
So it depends upon the center, I think.
Yes, sir. But I would still suggest that
Not to wear it.
yes,
Yeah.
not to take a chance, because
Yeah.
some
Yeah.
examiner might be tricky. He might interrupt you that, oh, you're wearing analog, and there goes your all confidence. So why to
Yes.
just go for it?
Sir,
Right.
okay,
Right.
right. But watch is not that important, but about the
No.
phone or valuables, like we are foreigners. I'm going from Bangladesh to Malaysia, so I would like to carry my purse with the valuables. So is
They
there any
will.
safe or any place to keep those things
Yes,
safely?
yes, definitely. They will give you a locker and an envelope to keep everything, and they will label your ID number over that, and they will hand over everything back to you. So don't worry. You can take anything. You can take your cabin baggage also. They will keep it.
No.
Don't worry.
Yes, like the just the purse and the mobile phone I'm asking for.
Yes. They will keep it in a safe lock and with your ID number labeled over it. So don't worry. You can take it.
Okay. Okay, thank you.
And
All right.
passport also, right?
Passport, yeah.
No, the passport will be with you. Okay, they will return back your passport with you. Before they are going to go for the registration, they are going to take all of your belongings, and they will only let you to keep your passport with you. So the only thing you will have is your passport.
No, sir. Actually, for our exam,
In
they
Mumbai?
asked to hand over everything.
No?
Everything.
The passport as well?
Yes, everything.
Yes, sir.
Okay.
Everything they
All
took.
right, but this is not the same scenario in
Yes,
KL
sir.
or in some other centers as well. Like in
Yes,
Mumbai, I
sir.
think it's much more strict, I guess.
Yes, sir. Hyderabad, when I gave in Hyderabad, they didn't take it.
Hmm.
But in Mumbai, they
Right.
took it. So maybe they
Okay.
keep on, updating the things.
All right. Okay. Any other queries? Any other questions? Yes, no? No? All right, good. Thank you so much, Dr. Savleen, once again.
Yes. Thank you, sir. Thank you.